Oh, hi there. Are you here for your eye exam? Well, I knew it. Right, so I'm Dr. Eclipse, and tonight I'm gonna be your eye doctor. Are you ready for your eye exam? Are you sure? Alright, well, when was the last time when you had it before? Well, seems like quite a long time ago. Well, right. And have you noticed any changes in your eyesight lately? Are you sure? Right. Well, we're gonna start with your vision acuity. I have a Snellen chart here, and I'm pretty sure that you have already encountered it. Right, so could you please read the first line for me? Right, what about the second one? That's way too easy for you, isn't it? Okay, what about the third one? Right, so, okay, like a piece of cake for you. Right, what about line number 4? Alright, good. Number 5. Are you sure about that one? Right, good job. Okay, what about the next line? Line number 6. So that's getting a little bit more challenging. Okay, right, number 7. Can you still read it? Are you sure? Try again, please. Well, now let's close one eye. Can you close one eye for me? Right. Okay, great. So I also have such thing. It could help you, don't you think so? Let's try to use it. Let's give it a try. Okay, what about now? Right, so would you please, with your eye closed, like one of them closed, could you please read line number 6 for me again? Good. Good job. Okay, so let's cover the other eye. Right, well now, could you please try to read line number 7 for me? Okay. Are you sure about that one? Right. No, okay. Well, that wasn't bad, but I'd like to actually proceed with this eye exam to examine your eyesight a little bit further. Well, now I would ask you to follow the light for me, alright? Let's have a look at it. Okay, can you see the light here? Amazing. Good. Now, could you please follow it for me? But I would ask you to follow it with your eyes only. Don't move your head, please. That's right. Okay, wonderful. Right. Good job. Okay. Now look at my nose. Let's test your peripheral vision. You can look at my nose. Exactly right. Please don't move your head. Once again, don't look at the light directly. And tell me when you see the light appear in your field of vision. Right? Okay. Good. Are you sure you're looking at my nose? Please don't get distracted. Okay, good. Right, amazing. What about now? Okay. Right. Great. Good job. Once again. Okay, now keep on looking at my nose and tell me where the light is coming from. Which side, or either if it's the bottom or the top of your field of vision. Okay, good. The same side. Okay, wonderful. What about now? Okay, good job. Keep on looking at my nose. Great. What about now? From the bottom. Okay, good. What about now? From the top. Alright. top again. Good job. Now please count how many times it appears and disappears from your vision, okay? How many times? 3 times. Good job. Keep on looking at my face. Okay. Now please count again. So how many times? Okay, 4 times. Right, you're amazing. Good. What about now? That was 5 times. Right, yeah. And now finally. How many? 2 times. Okay, just twice. Wonderful. Now please let me know, what kind of light does it seem like? What color is it? What shade is it? Is it like warm or cold? Okay, and what about this one? Can you see any difference between them? Right, amazing, good. Okay, now, so I would ask you to follow the yellowish warm light for me. Please follow the yellow light. Good job. Scan. Right. And now once again. Okay, now please look at my nose and tell me which light is a little bit closer to you, okay? But don't look at the lights directly, just look at my nose. Right, let's start. Okay. Good. Good job. Exactly. Okay. That's right. Wonderful. Right. Okay. Now, please look at my nose and tell me how many circles you can see. If it's just one circle or maybe 2. If it's like that, so there's still like 2 of them, right? Exactly. Okay, great. Are you ready? Okay. Keep on looking at my nose, please. We're still testing your peripheral vision, your sight. Okay, and now please look right in the center and tell me how many circles are there. Just 1 or 2, okay? Okay, and what about now? How many circles can you see? 2 of them. Okay, are you sure? Once again. 2. Okay, wonderful. Thank you. Good job. Now, look at my nose and tell me how many fingers I'm holding up. Good. Okay, now close one of your eyes and also tell me how many fingers I'm holding up, okay? Now, the same thing with the other eye. Alrighty, well that's not so bad actually. Now tell me when my fingers appear in your field of vision, So now can you see them? No, you can't. And tell me when you can again. Okay, wonderful. Okay, good. And what about that? Alright. And now they disappeared again. Okay, now please look at my face again, at my nose, and tell me when you see my fingers wiggle on either side, maybe on both. Looking at my face, please concentrate on me. Don't look at my fingers directly. Okay. Good. Wonderful. Okay. Now, let's test your color blindness, if you're color blind or not. I believe that probably no, but I'm gonna check it right now just to be on the safe side. So first let's see what colors of lines you can see here. So what color is this? This line? Just green. Okay, what about this one, the bottom one? Red. What about this one? What color is it, do you think? And this one on top. Okay, so it's blue. Right, yeah. Okay, now let's try something a bit different. What color is it? It's just white color, are you sure? Okay, what about this color? Okay, good. Well, now what about this color? Is it similar to the previous one? I will show it to you again. Is there any difference between them? Which one is a little bit darker, maybe kind of brighter, more saturated? Okay, got it. What about this color? Green again, that's right. This blue, alright. Now what about this color? And what about this color? Okay, it's white again. And what about now? Okay, good. Now, how many colors can you see here? Are all three cards all different colors, or are they all the same? So, do you think which one is the darkest out of three? This in the middle is the darkest one. Okay. Now comparing these two, do they look exactly the same to you? Are you sure? Okay, how would you describe this difference between them? Okay, I got it. What about this color? This. Okay, wonderful. Absolutely. You're absolutely right. Okay, about this. Amazing. Alright, so with colors, like when they're taken separately, it seems to be totally fine. Now, let's try a few Ishihara charts. Let's start with this one. So, can you see anything inside the circles? What can you see in this one, for example? Can you see anything, any shapes, maybe some numbers, letters, whatever? Okay, good. And what about this one? And this? Okay. What about the bottom one here? Right. And now to this one. Can you see anything here? And finally the last one. Wow, that's an amazing result. Good job. Okay, so you don't seem to be colorblind. Good job. Okay, now just a few more cards. You seemed to like them, so why not? Let's give it a try again. Okay, so can you see anything inside this Ishihara chart? Inside this circle, is there anything hidden there? Any kind of symbols, letters, figures, shapes, whatever? Are you sure that you cannot see anything there? And let's try the similar one with similar colors. So what about this one? Can you see anything? Okay, I'll bring it closer to you. What about now? Can you see anything inside this circle? Something similar to letter E. Okay, wonderful, good. Now, what about this one? Can you see anything inside this chart? That's this rectangle. Okay, something similar to a snake. Good. Good job. Okay, now, what is it? It's a triangle. What color is it? Is it all the same color, or can you see any kind of like shades of colors inside it? How many shades can you see here? Okay, let's have a look. What about this one? And onto this. Okay, amazing. Good job. You're doing so good. Right. And now one more. I promise I'm not gonna torture you for a long time. I remember you also have your hearing test today, right? So I have to let you go. Okay, well, so what about this one? Can you see anything? Okay, how many smaller rectangles can you see inside this big one? 4. Are all 4 like similar in shades? Are you sure? Okay, what's the difference between them? Which one is the darkest, do you think? Can bring it closer to you this way. So which one is the darkest? This. Okay, amazing. Good. Well, you did really, really well. Thank you so much for this test, and thank you so much for this eye exam. So it was a pleasure to work with you. Okay, now just for another moment. Okay, could you have a look at my face and blink? Okay, great. So corneal reflex seems to be working just fine, and now we'll blink again. Okay, great. Now let me have another look at your pupils. A little bit closer. Do you feel tired yet? No, are you sure? Okay, just another look. You seem to be just fine. Okay, now to this eye. What about? Okay, good. Now, well, you seem to be quite healthy. So I hope that you enjoy your ear exam as well. And say hi to Dr. Lunar, okay? Promise you will. Okay, great. Well, I'll see you soon. Have a good one. Bye. Hello there. I'm here for your urine test. Alright. Wow. Sounds great. So, can I ask you, when was the last time when you had your ear exam? Alright. And since then, have you noticed any changes in your hearing? Maybe any kind of clogging in your ears? Or any other things related to some kind of distortion? Okay. Are you sure? Right, well, and talking about everything related to your hearing, do you think that your hearing is it like good enough in your everyday life? Can you hear everything people tell you, people say, and can you hear all the rest of sounds and noises of the surrounding world? So you think so? Are you sure? Okay, so we'll check it today. Well, let's start with the inspection. I will have a closer look at your ears if you don't mind, of course. Is it okay if I touch your ears with my hands? I have just put on my latex gloves, so don't worry. Everything's gonna be clean, so it's alright. Okay. You don't have germophobia, do you? No, it's gonna be fine. I can guarantee you that. So I will just touch your ears really, really slightly. Good. What if I press here a little bit? Is it alright? Do you think so? Okay. Okay, good. Well, now I'll take an otoscope and we'll have a little bit closer look with an otoscope, okay? Great. So, okay. No, not so bad. When was the last time you cleaned your ears? Well, how do you usually clean them? You know that you're not supposed to do it like too hard, yeah? Just water will be fine. It will be more than enough. So please do not try to clean them super thoroughly with cotton swabs and stuff like that, because sometimes you can only make it worse by pushing the earwax like further in your ear canal. You don't want that, you don't need that, so please be careful. What about earplugs? How often do you wear them? Different kinds of like earphones, earplugs of all kinds? Are you sure? Can I trust you? Okay, good. Right, so let's start with a really simple test. I will make some sounds in my gloves and you will just let me know what kind of sound you heard, okay? Let's try. So it was more similar to snapping. Okay, what about now? Rather clapping sound. Okay, great, good job. Now it was more like tapping plastic, metallic stuff. Right, yeah, okay, great. Okay, and what about now? So that sounded like a brush on some surface, like in this case on my gloves. Right, yeah, exactly, good. Okay, now please tell me how many snaps you hear, okay? Good job. What about now? Okay, once again. And once again. Good. Okay, amazing. So now, please tell me what side the sound is on. Good. And now, right, and what now? And now. Great. Now you don't need to let me know which side the sound is on, but please tell me when you hear the sound change its side, its direction, okay? Good. Good job. Now I'll make some noise with my gloves, with my hands, and I will just whisper some words to you, maybe some numbers, like stuff like that. So just let me know what you hear, okay? Okay, great. 1, 54, lipstick, 36, 100, latex gloves, microphone, ice cream, persimmon, vanilla, 55, 42, 70, laptop, sunglasses, hairstyle, monkey, notes, closet. Okay, good job. Wow, it wasn't bad at all. So you heard most of the words correctly, so that's really great. Okay, good. Now tell me which ear the sound is in, okay? Oh, on. Good, are you ready? And now you can even keep your eyes closed if you want. What about now? Alright. Good job. Now, okay. Wonderful. Alright. Good job. Now, please tell me how many strokes, how many separate brush strokes you've heard, okay? Great. Good. Right. Wonderful. Okay, great. Okay. Yeah. Okay, great. Now, I suppose you probably know what this tool is. It is called a tuning fork, and I'm gonna check your ears with it. It's quite easy, it's quite simple. I will just put this thing right behind your ear, somewhere there on that bone, and you will have to let me know when you stop hearing the vibration and the sound. If you don't hear anything at all from the very beginning, also let me know. Okay, good. So now let's do it. Okay, once again. Okay, good. And now I will put it right at the top of your head, in the middle, and you will let me know if you heard this sound symmetrically on both sides, okay? Okay, good. Well, how was that? Good. Okay, wonderful. No, did really great. No worries about that. Okay, well, now to the next one. I have these headphones for you. guess what we're gonna do with them? So it's gonna be some kind of a like hearing beep test. Okay, so if you have ever tried it, okay, then I'll explain the rules to you. I will put on these headphones right onto your ears. I mean, it's quite unexpected, right? So what I'm gonna do is put the headphones on your ears. Then you will hear some sounds, like mostly beep sounds, maybe something different, and you will have to answer my questions, like for example, how many beep sounds you've heard, or just let me know when you hear the very first one, you know, like stuff like that. Nothing really challenging. It's actually quite fun. All our patients really enjoy this beep test. Okay, let's do it. Okay, are you ready? Just relax. It's gonna be all right. Oh, okay, good, wonderful. Are you ready? Can you hear me well? You can still hear me. Okay, perfect. So now, please let me know when you hear the first beep sound. There might be a few of them, but you just need to let me know when you hear it. Okay. Good. Now, once again, let me know when you hear the beep sound. Okay, great, perfect. Now, tell me how many beep sounds you've heard. So, 3 sounds, okay. What about now? 2 sounds, okay. What about now? 4. Wow, alright. Now, please tell me if all beep sounds are the same in length, okay? Let's try. So, were they all the same? Okay, got it. No, you're right, absolutely. Okay, good job. So now, once again, quite the same thing. So, and which one was actually the longest? The very first one. Okay. So in the previous one it was the last one that was different, and in this one it was like the very first one. Okay, got it. Right. Okay, good. Now please tell me when you hear the second beep sound. Okay, you can just nod to me. Good. Okay, good. And now once again, let me know when you hear the second sound. Okay, good, great. So you're actually doing so good. Now, please tell me how many beep sounds you've heard again. Okay, good. And now once again. So how many sounds was that? Exactly. And now, finally, one more time. Just count how many beep sounds you've heard. Oh, okay. Great. Good job. Wonderful. Now you can take these headphones off. Okay, so how many beeps you've heard? Exactly. Wonderful. Well, you actually did so good. I'm so really proud of you, and that's really great that you didn't have any difficulties during this hearing test, during this ear exam. I'm really glad about that. Good job. Well, I guess that I'll see you pretty soon. Sure.